All right, so we're going to finish up. So I just want to show everyone and review and bring together. Sometimes, we come to these events and there's so much great things happening, it's hard sometimes to digest it all. So I just want to show you some of the testing that you can do currently in your office that's available, and some of the things we found to be the most valuable when you're trying to gather more information, right? And really, if you look at any testing you're doing, it's really ESP. We're just trying to gather more data, which is evaluate. And as Dr. Ella has stated so many times with meeting with her over the last 20 years, that patients have the answers. You just need to know what questions to ask, right? They know the cause of their disease better than any MRI, ultrasound, or any type of other test that you're going to do. They will tell you what's going on if you ask them the right questions, right? So you need a really good system to evaluate. Then you always want to support them, right? They need support and empathy. And then if you don't provide a solution, then we haven't followed through like we need to do for all the patients. Let them tell you it's too expensive, they don't want it, it doesn't taste good, they're going to check with their doctor, their cousin, their aunt, their boyfriend, their sister, their mom, or anyone else, right? Our job is to educate them and inform them so they can make an empowered decision. Just like our kids, they may not make the right decision. However, the responsibility is off of us. I meet a lot of medical doctors and they say, none of my patients want to do this. Usually they don't want to do it. Right? The offices that sell the most powders are the offices that the doctor and the staff do the powders. So the patients will do what you like and what you recommend and let them tell you no. And if they don't do it, even myself, who's not a doctor, I always write down in their file when I did nutritional consults or at the events, I recommend this to the patient, however they decided not to take it. And I'll tell them, look, if you're not feeling well in 2 or 3 months, you probably want to do the whole protocol. Right? So let them tell you no. So this is a great system that any doctor, staff, healthcare professional, nutritional consultant, whoever it may be, these are vital tools everyone needs to use. So here's my background so you know how I got here today. I know you're shocked. I don't look that old. How can I have graduated so long ago, right? So I've been doing this 26 years. As Todd Parker was mentioning earlier, the years go by very quickly, right? So I have a BS from Slippery Rock. I went through the American College of Sports Medicine's program for personal training. And I remember back then when I was looking to get out of training and someone said, why? I says, I don't want to be the old 50-year-old guy in the gym. And now I'm almost that old 50-year-old guy in the gym, right? It's not old anymore. But I worked in sports nutrition and personal training in the 90s. And then right around 2000, I decided to go and work for Metagenics because of Dr. Bland and his incredible training program. And that's where I met a lot of people in this room, right? So it was just a stepping stone. And, without them, I wouldn't be here. And that's where I met Dr. Weiner and Dr. Steve and Ella and, probably half the group. So I went to Florida and worked for Metagenics as a district sales manager and then a regional director. And before they were sold, I decided to leave. And Doc and I started Nutritional Frontiers. And it's almost 10 years already. So the overnight sensation takes how long? Usually 20 years. So we're halfway there. And recently, one of my clients, Dan Wagner, decided to transition in his career. So me and a couple colleagues decided to buy his business, which is NutriPharmacy. Dr. Weiner, of course, is the president and co-founder of Nutritional Frontiers. He's still the director of the Weiner Wellness Center. And he does allow people to shadow or come to his clinic anytime and see what he's doing. So if you like that, he loves that. And you can see some of the unique techniques and practices he does. So if you do nothing else in your office, or if you have a staff or a spouse or a nutritional consultant in the office and you don't know where to start, I feel this is the best place. Is Dan McPherson still here? That's probably appropriate. Dan does not like the spotlight, so I think he ran out of here before I embarrassed him. But Dan is the author of the Professional Training Guide. We do put a value on this. It's probably worth thousands of dollars. I mean, this is hundreds of years of experience, but it gives you all the tools you need to do a really thorough history on the patient. It looks at all testing from blood work to visual analysis to nails and hair and even some of the spine points to look at how does that correlate. It goes through all the programs we offer, and we're not in the pill business. A lot of the perceived competition of ours is in the pill business, right? They just sell vitamins. They don't do diets, and they don't do exercise programs, and they don't do education and seminars. We do, and it's all in the program section. So we always look at food, activity, stress, sleep, and then customized supplements. They are called supplements for a reason, right? They supplement a good diet and lifestyle. You can't out-supplement a bad diet, and you can't even out-drug a bad diet, oftentimes. Then we have a whole section on conditions. So maybe it's something like Bell's palsy that you don't see every day in your clinic, but you can look it up and you have a reference point to see what may be causing it, and you may be surprised to know that's a muscle issue more than anything else. And then the consumer health alerts. Anyone seen the consumer health alerts before? Master the fundamentals and seldom you need anything else. The consumer health alerts will answer the most common questions you get in your office, such as, why are statins bad? Why do I need minerals with blood pressure medications? You know, when do I take a probiotic after an antibiotic? So this is available just for a qualifying offer. Everyone in here pretty much can get one. If you don't have a new one, talk to Mike or myself or anyone on the team. And I also have my cards in the back. I want you to take one before you leave, because if you're interested in doing blood work in your office, you can just email me and we can set it up for you. So if you're doing any type of, everyone doing natural healing in their office, right? That's why you're here. I equate it to being blind, okay? If you want to do this blindly, then don't listen to this part. If you want to do this with 20/20 vision, the only way it's possible is by having a PDR on your desk. Now this one you can tell I've used, and you see all the yellow stickies in there. What are those for? Those are the most common drugs people come in on, right? Lisinopril, Lipitor, right? Antibiotics. So you have to have this there. What I do is I open it to the drugs that the person's on, then I hand it to them and let them read the side effects while I'm making notes. What happens when you do that? If I tell them, they doubt it, right? If they read it, it must be true. Let them read it. We also have an outline of this in the professional training guide. It's the first page. Has anyone opened the book to the first page? What's the first page? Nutrient depletion from medications. It's an overview of 2 pages. You can do that first and then go into a specific drug they're on. There are no studies that I've been able to find that's been done on polypharmacy where people are on 2 medications or more. However, 50% of the patients are on 2 medications or more, and maybe more that are coming to see you guys, right? So you need this on your desk. And I like to learn history, and Henry Ford, one of the smartest people in our country, created the whole assembly line for automobiles. And you know, he didn't invent the automobile, but he did. He invented the automobile for everyday people like us, right? Before it was a luxury item for only the super rich. So you don't need to know all the answers, you just need to know where to get them. So you got to have this on your desk. If you don't, you're in trouble. You ever have a person come in and they're on some product that they found on the internet and they ask you, what about this herb, right? And you can't know every single thing out there. So you need to have this on your desk so you can look up any of the herbs or supplements or vitamins or minerals somebody's on, just to get a little quick refresher, because they probably know that herb because they've looked it up for months, or even their disease state, and you may not know it as well. So those 2 books are vital before you move any further with any patient. Now we have a Fit Life questionnaire. It is in this book on the history. These are all the questions, and we just did a recent event where we had people come in every 15 minutes to do a quick consult. And these are the questions you need to ask them to be able to do a 15-minute consult or longer. So anyone use the Fit Life questionnaire? Yeah? Okay, great. And you can utilize this as part of your program. You can take bits or pieces. You can steal the whole thing. We don't care, right? You have complete 100% approval and permission from us. But this is going to ask them their history, right? Some simple information. Height, weight. How do you know what their height and weight is? You better put them on the scale, right? Because if you don't, you're gauging their last reading or their last weight or what they like to say they weigh, which is usually not quite the same, right? I tell everyone right now I'm 210, but probably 216 to 218. Also, we'd like to know what their BMI is, their body mass index is, and their body comp, what medications they're on, and what supplements they're on. Not only what supplements they're on, but where do they currently buy their vitamins? Why do you want to know that? Yeah, you want to know their buying habits, their quality. I ask them to bring in their vitamins because I want to be able to go through them and and do a nutritional review. But these are all the most common vitamins they take. So then you want to go through their food, their activity, recommendations, and then how to take it. You know, I learned this from my daughter when she was in kindergarten. There was a big sign when they walked into the classroom. And it said, if you tell me, I'll probably forget. So if you tell them what to do, they're not going to remember. How could they? You just went through an hour worth of all this information never heard before. So if you tell them, they're not going to remember. They'll probably forget. Okay? But if you show them, they may remember. Write it down for them, make a copy, and as simple as this may sound, we're probably not all doing it all the time, give them a copy to take with them, right? Write it down because they don't know when to take the vitamin and how often to take it. And they take it with food or without food, right? This is the way you do it, just by customizing it for them. And if you wanted just to quickly do a program, you could always use our wellness solutions. Has anyone used the wellness solutions before in the room? We have these for every body condition. So this is for weight. Our number one program is for joint solutions. So if you're suffering from a hip issue, go with joint solutions. Tells you what to do exactly in there. Now, this is the creme of the creme, right? This is the best of all the students out there. So I know you guys did not use Cliff Notes, right? Nobody did. This is Cliff Notes. It's okay to use it for you and the patients, right? So you can easily customize a program based on the tools I just showed you. That's what I call level 1, right? Now we're going to show you what you can do level 2 in your office. That's the inside of the booklet. So here's the scale you could use, right? Anyone have a doctor's scale in their office? The only problem with this scale, it only goes up to what, 350? Yeah. I know it's funny. It's not funny for the person that weighs over 350, right? So again, we can chuckle now. Now's the time to chuckle. When a person's in your office and they don't want to get on the scale, it's probably because they weigh more, and it's okay, right? They're in your office. Half the battle's over. You could use a tape measure, right? If you want to show improvement. Even if you just measured the waist or the thighs or the arms. However, if they do weigh 350 or less, you can use a handheld device that will give you BMI and body comp. So the least expensive tool we can find out there is a handheld body comp. Anyone use this in their office? No? We do. It's under, how much was this? Under $100, right? Very inexpensive. It takes literally 2 minutes. You just got to punch in a little bit of information. They hold their hands, and it gives them some really accurate, reproducible information. So not bad, right? So if you want to start somewhere, you can always start here. If you're not getting that data, it's pretty hard to be able to customize a program for somebody because you don't know what their BMI is, you don't know if they're overweight or underweight, and you don't know what their body composition is. And rather than body fat, that's one way to present the information to someone. That's a little negative, right? Your body fat's 30%. Sounds high, right? You could give them the opposite number, right? We all know 100 minus 30 is 70. What does the 70 indicate? Lean body mass. Why is that more positive? We want lean body mass to do what? Go up. So you can say, oh, your body fat's 25, which is okay, but really good news, you have 75% lean body mass. So we're almost at our goal. So this is a great tool we've used at our events. Very easy to use, very inexpensive. You don't need a lot of training on it. If you're a little more sophisticated, there is technology out there that you can go to bioimpedance analysis, and then this would be the Cadillac. So if you like Cadillacs and you like all the bells and whistles, this is the high-end machine. The nice thing about the InBody now is they do a 2-year same as cash. So for less than $500 a month, you can get a really nice top-of-the-line equipment and technology that will do not only weight, body comp, it also do hydration levels, which is really important to show toxicity in somebody. This is the Omron. Omron, I think it's by Tanita, or Omron, the company. Yeah. And we can show you where to get it. I think the girls will help you in the back. Okay, so this is available, very inexpensive, very easy to use. If you want, there's levels you can go up, and each one is going to give you a little more information. So, you know, when you're starting out in business, you do something like this, and then you get more sophisticated, you can go to the higher levels. These guys, they're always laughing, so they must love what they do. Now, there are other questionnaires you can use if you want to go deeper. We have a health appraisal questionnaire that's 12 pages. My experience with that is people score really high or zeros. So it's a little more subjective. You got to rely on the patient's feedback. I like to ask them the questions. However, it does take a while to do, and you'll find some people score really high. If they score really high, the simple solution is to do a cleanse and then retest them, okay? We also have one available that I like a lot more, is the quick nutritional assessment. This goes through all the body systems. So if someone has an immune issue, you can go right there. If they have a spleen issue, allergies, whatever it may be, you just correlate in the body system quickly with some kind of solution. So do you guys think you need blood work? Does everyone have their patients do blood work before you do the program? Who does? Try? Trying's dying, right? It's tough to do if they don't have the blood work, right? So wouldn't it be great if you could offer blood work to all your patients? Wouldn't it? Yeah, it'd be great, right? Don't you guys agree it'd be even better if it was paid by somebody else, the insurance company? Yeah. And of course, you want to be able to select the items, right? So here is a company we partnered up with. It's called AccuReference Labs out of New York. Been working with these guys and gals for the last couple of years. And some of our top clients, including, if you know, the guru, Dr. Tom Bilella, he uses this lab extensively and exclusively. So the nice thing is you can do a fasting test or a non-fasting, because we learned today maybe a fasting isn't the best way to determine triglyceride levels, right? So you can do non-fasting or fasting. Here's all the different tests you can offer. And the great thing at the bottom is all the ICD-9 codes that's justifying the test. You could pretty much get away with doing a full panel for a patient about every 6 months. If it's something like a diabetic where you want to do A1C levels, you can do them every 3 months. And there's a glycoprotein test on here that I'm a little afraid of, but you can offer this every 2 weeks. Why would you want to test glycoproteins? If you test somebody's blood sugar, they can be good for a day or two before the test, and the test shows good, right? A1C is a 3-month average, so you're getting a better indicator of how well this person's been for over 3 months. The glycoprotein is something new, and the reason you want to do it frequently is that you can tell if the person's cheating. So maybe their blood work is good because their blood sugar is good when they come in. Their A1C is not too bad. But you have them do the glycoprotein every 2 weeks, and now you're seeing they're cheating, right? So there's some really valuable data. You can do the test every 6 months on anybody, and then you can do follow-ups as frequently as every 3, yes.
Okay, so how does that interfere with, let's say their regular doctor is testing them as well, and they're billing insurance for that, and then we try to test and get paid, like there's...
So the other doctor's regular, so we must be irregular in this room, right? You hear that a lot, right? When I go to my regular doctor.
So how is that as far as getting paid if the insurance, typically only wants to pay for it twice a year, and now we're asking for additional?
Well, if they just had blood work done, and if even it was from a regular doctor, we can still read the blood work, right? So have them bring it. How many times do you ask the patient, when's the last time you had blood work done? They says, recently. Did you get a copy? What do they say? My doctor didn't give it to me. So what you want to do is make sure two things. One is, when's the last time they had the blood work done? And did they bring it with them? Because if they didn't bring it with them, then not much you can do, but you can get a copy of it, right? And if they've had it done recently, use the blood work they have, and then you can start doing and offering the blood work for them moving forward. So as long as you have a little bit of a buffer, they like 3 months, you could probably do a retest in 3 months. And if they haven't had one in 6, you can definitely do that. Good question though. Any other questions as far as frequency of the test? Okay, so here's a test you can offer. The nice thing is that they accept insurances, everything except for Medicare will cover this test. And some of these tests, if you do, probably most people will do 80% of the test on here, right? Because you may not need hormone panels if there's no hormonal issue, or you may need everything done the first time. Some of the tests can go up to upwards of $2,000, right? The good news is, well, the bad news is the insurance may not pay the $2,000. So say you had every single test done on there and it cost $2,000 to the insurance company, okay? If the insurance company covers $1,200 out of that $2,000 or $900, the patients will receive a bill. However, AccuReference subsidizes it, so the patients do not need to pay out of pocket, and there's no financial responsibility to the patient. So whatever the insurance company pays, they will accept.
Is there a way to check that prior to them sending or doing the test? Like, are the codes on there to call the insurance company and say, hey?
There's no need to check because the patient's not responsible for anything. They don't have to pay a dime. Yes?
Where you gotta send them to get the blood work done?
They can, the phlebotomist will come right to your office. So if you don't have a huge practice or a huge amount of people you want tested, you know, a half dozen to a dozen would be a good amount. Maybe you set them up on Tuesday or Thursday when you have lower patient flow. Get them in early, especially if you want to do non-fasting or fasting.
Are there cash rates?
Yes, we're working on some cash rates right now for Medicare, or if somebody did not want to use the insurance, or if they didn't have insurance. I have to see exactly what test you're looking at for Lyme's. I know some people look at sedimentation rates, some look at specific inflammatory markers, but I can check on that for you.
You said ICD-9 codes,
Yeah.
they need to be 10 codes?
Are they 10 now?
Yeah.
Okay, that's how long I've been doing this, so. Yeah, all the codes at the bottom of this form right here. This is just a sample. You may want to update this for your office. You may want to subtract a few things or add.
Let me ask you the scope of practice question. With, let's say you have somebody comes in and they've got increased cholesterol levels, so you want a blood panel, CBC, and you need to pick the correct ICD-10 code for that, so that sure
Mhm.
makes sense to you.
Yeah.
Scope of practice, is there an issue in Pennsylvania?
Not according, not from what I've heard so far, no, not a problem at all. So every situation is going to be different, and we're going to work through some of these challenges or obstacles we.
Are the phlebotomists going to be carrying a centrifuge machine to spin down the blood right away?
I'll get the answer on that. I know that this blood also, they recommend using SpectraCell also, and the blood can be used for both tests, SpectraCell and this. Yeah. And I don't have all the answers yet, but I know other offices that have used this in other states have done really well with them. So the only trick in PA is that the lab cannot provide the phlebotomist to the office, okay? So what we found is that a lot of phlebotomists are looking for part-time work, right? You have MAs, PAs, whatever they may be. And all you have to do is charge maybe a drawing fee anywhere between 20 to 50 bucks for the patient. So the idea, the solution to the patient is, look, it's going to cost you 20 bucks out of pocket. Everything else is covered, and this test could be, in excess of $1,000, but you're only responsible for 20 to 50. And I think the phlebotomist could probably draw at least 4 to 6 people per hour. So if you're getting 20 bucks per person, it'd be more than enough to cover the 20 whatever dollars per hour for the phlebotomist. Yes.
So those of us who just have a BC license, where does the liability?
Oh, you're an O doctor, right? You've heard that before, right? You tell someone you're a doctor, they say, what kind of doctor? I'm a chiropractor. And they say, what? Oh. Chiropractors are covered in PA. You can recommend it, and you can have the blood drawn in your office. Yes.
Where does the liability
Liability
fall? The phlebotomist or on our life?
for,
If anything would go wrong.
well, if you have a license for phlebotomist, I think you're covered, but again, we can get that answered for you. So all you need to do is grab my card on the way out, and if you're interested, you can email me, text me, or call. And if you don't have a phone, you can mail or let me know before you leave, and I will cover that, okay? After you get the blood work done, if you do it in your office or even now until then, you need to be able to read the blood work, right? And you don't have to memorize all these terms, but right in the professional training guide, under testing in section 2, we'll have all the blood values, and then it tells you in there if it's increased or decreased, what could be causing it, what's the optimal ranges, and then what can you do nutritionally if you're trying to increase or decrease that number. The nice thing too, as we know, when they go to their regular doctor, what do they do with the blood work when they look at it? If it's not high or low, oh, you're fine. They never look at connecting the dots over a period of time and saying, hey, your numbers are creeping up. You're not quite there yet, but we're going in the wrong direction. So that's a really good value you can bring to your patients, is show them, hey, here's some tendencies going on that we need to address now. We don't want to wait until the heart, you have the heart attack. We want to try and catch it earlier. So that's already provided in this book for you. We also have another book. You okay? I love working with these guys. They're always making me laugh, and that's not an easy feat. So here's a book. I've met so many great people over the years. Dr. Juan I've known for 20 years now, and Dr. Ella, one of the first docs I met when I worked with Meta, and another one was Dr. Dan Wagner. And he was a traditional pharmacist like Rich Knoll was for 20 years, and then he had the courage after he learned what was going on with a lot of medications. He went to a seminar in Canada and decided to be a natural pharmacist, and that's when he transitioned into nutri-pharmacy about 20 years ago. But he's told me about this book he's been working on for 15 years. I always hear about it. Well, it's finally complete. This takes the blood work to a new level. There's over 130 readings of different blood values. And what he did was he did a meta-analysis. He looked at all the different labs out there and what their ranges were, and then he came up with what he thought were very functional ranges. There is a small fee for this. They're $20. If you want one today, you can grab one. You can give us $20, or we could bill you either way. But this has to be another tool that you have part of your practice, especially if you're looking at blood work. Because if you don't have the tool, it's very challenging to be able to know all of the values and what are some of the connections. For example, eosinophils, I learned over the years, when those are elevated, think parasites, right? So there's a lot of things you can learn over time just by looking at the blood work and having a good reference. There's some other labs, of course, the old Great Smokies labs, which is now Genova. They do a lot of genetic testing. And they have a really good testing called NutriEval. There's ZRT labs, David Zava's lab. There's SpectraCell. You have things available out there like neurosciences for neurotransmitter testing. There's a lot of labs out there, and it's great to gather more information. The key is, what do you do with it, right? So here's just some examples. The GI testing, of course, SpectraCell analysis, adrenal stress cortexes, which you'll probably find usually cortisol is flip-flopped, so you can do these testing as much as you like. It's just going to give you more information, and eventually you got to take that testing and apply it. So a lot of this is available now at no cost. The book is a small fee, and if you're interested, we can bring the blood work to your office, and we're going to be doing it over the next 2 to 3 months. Then at our next event in June, we're looking to bring in AccuReference to do a small part at the end. to help you with not only the process in the office, but also the recommendations. So questions at all on some of these tools that we have available? So of course, we always run a special, so you can get specials on all the product line. We do 15% off. That's available now. Today is Saturday. Usually we do these on Thursdays. So now you can put an order in today through the end of next week. And if you want to order every single day, like Rich Snow does, takes full advantage of the special. And something he does that sounds so simple, but I find most of our clients don't do it. If you're getting a special, maybe you want to pass it on to your clients. So I appreciate everyone coming out today. Thanks so much for our two incredible speakers, Dr. Ella and Todd Parker. And thanks to you guys for attending. Questions?
Date in June.
The date in June for our seminar. Michaela? You don't have it?
That's a Saturday.
Yeah, we're looking at a Saturday. And I think in the fall we'll do a Thursday. Yeah. So Thursday, June 22nd. Thank you. Because I know some people can only make Saturdays, some can only make Thursdays. So we try and balance it out for you. Thanks so much, folks. We appreciate it, and we look forward to seeing everyone at our next event.